Rhyme brothers need to break their pens. Uh-oh, it's the love movement, never ends. The rap game will never be the same again. He came again.
Here I come again, you feeling fine? The dog is like an overflowing rhyme. Mine usually mess with shorties who's an 8, 9.
Hey guys, what's up? It's Rich over here. I got my main man Sam.
What's up?
And today we're going to be talking about males in the nursing field.
Mm-hmm.
So I know, some of you guys and ladies, probably heard, all the stereotypes and everything about nursing, how there's mainly, females and everything, stuff like that. But, we're just going to give you a little side of like how we see it. So, Sam, like what are some of the things that you've heard in the nursing field?
In the nursing field.
About guys.
Oh man, there's been a lot. I mean, it's weird how we got into it, especially I guess young African guys. I don't know. The things I've heard that it's a very female like dominant profession, right? If you do nursing, I don't know, you're just like inferior, maybe to all the other medical professionals. What else? I mean, those are pretty much the major ones.
Yeah,
right?
like I know how some guys, when you talk to them about nursing, it's not the first field. Like when you talk to them about the medical field, nursing is not the first thing that comes to mind. And be like, oh, I want to be a doctor. Oh, I want to be a surgeon and everything, stuff like that. You don't hear a lot of guys be like, oh, I want to go to the nursing field. I want to be a nurse practitioner.
Yeah, that's not your usual like a route.
I want to be like a scrub nurse. You rarely hear guys saying that. But, there are a few guys out there that see the nursing field and, like the holistic aspect of it.
And as a good opportunity, to take.
So, like, I know how, like, the percentage, the percentage of guys that are in the nursing field today compared to, like, females and stuff.
What did you say?
It's like 90%. So 90% of females are in the nursing field today. So like as occupations, girls that are nurses versus guys that are nurses. So that means only 10% of us
least 10%.
Yeah, at least 10% of us are actually, working as male nurses.
And this is like in comparison to all the way back in the past. I mean, the past was probably 99%, 100. Of obviously girls, back in like the World War.
Especially like, definitely like the Florence Nightingale and Clara Bartons and stuff like that. It was
100% nurses.
It was just, the guys were in the war just fighting or whatever, and then, it was just the women that weren't doing anything. So it was like, hey, let's help these guys out and stuff,
And usually it's the guys who were the doctors back then,
So it's only been like a few decades since like, the first males were actually started in the nursing field, and they actually, started taking the roles of helping out, the roles of like, that Florence Nightingale and Clara Barton did, and taking the initiatives and doing the the regular process that nurses do and everything, like admissions and then, taking care of the patient, all the aspects spiritually, holistically, mentally, physically, all of that.
Yeah, and I mean, moving forward, I mean, why do you think like guys fear nursing?
I think one of the things that we mentioned in the beginning, like some guys see it as like female dominant. They're like, oh man, I don't want to be a nurse because all they do is just sit around and stuff. They just focus. It's a girly thing. Girls. I mean, not girls, but like females. They'll be like, oh, can I come and fluff your pillow, or do you want me to move your bed up, the head of the bed or anything? It's like, oh, they'll just be on call. They'll think they'll just on call and that's it. They don't do anything else.
That's very true. And that actually sucks about like people just think like nurses like I was just talking to him before the video like, oh, if you had to talk to your average person on the street. What do you think a nurse does?
If you ask a regular guy on the street or
anybody,
just anybody, but like if they
don't, usually the girls know more.
Yeah, some of the girls know more, but like if you ask like your old fashioned your guy or whatever, but if you ask them about hey ask them about the nursing or the medical field in general, they'll be like, oh, doctors are great things. Guys in the medical field. All right, what do you see? What do you think about like nursing? Blah, blah, blah. It's like, oh, nursing, mainly females and stuff. To just helping you out.
Right
like,
off the top of the head,
not really as big as doctors and everything. And then you don't really hear. And then if you brought up like a guy being a nurse, they'll be like, oh, really? Why didn't you become a doctor or anything? And it's crazy too, cause like I know in my family. I know I had like some, like my aunt is, you know, she's not forcing me to, you know, do what I want. I want to be a nurse, blah, blah, blah. But it's like, you know, she's giving me the option. She's pushing me towards being a doctor and everything. And I'm like, you know,
Really?
if I want to be a doctor, I'll be a doctor. But, you know, I like the nursing field because it's like I've already experienced everything, you know, in the nursing field since high school. Like in the previous videos, we've all talked about nursing and, you know, how it's affected us and stuff, and, you know, how we just want to move on from there.
Exactly.
So,
would she have a problem with you being like a nurse practitioner?
no, of course not. I told her, like,
wouldn't that be a better choice?
That's what I'm saying. Like, you know, if anything, like, I want to get my doctorate in nursing, so that way, you know, I'm up there, but at the same time, I'm still doing, you know, I'm still caring
patient care, individualized.
I'm still thinking about, you know, about the whole process of, you know, assessments and interventions and everything and stuff like that. I'm actually implementing them more than, you know, the usual doctor would do. So that's the reason why I mainly wanted to be a nurse and stuff. And then, like, you know, the science and mathematics aspect still plays a huge role in it as well and everything. And it's, you know, guys, not a lot of guys still see like nursing or whatever as you know, as a field. You know, they want to first do whatever, you know, they still say I'd rather be a doctor or something like that. And it's not a lot. Like in my nursing class this year for SUNY Brockport, I'm not in the class, but, like, you know, the nursing class this year, out of 74 students, no more than 7 of them are guys. So it's like, you know, 10% of that. And then the year that I'm applying, over 200 plus students are applying, and, you know, no more. I don't want to say. I don't want to say no more than 20.
50%?
Not even no more than 20 students.
Oh
itself.
yeah.
So like no more than 20 guys themselves are actually applying for the program. And it's like, wow, not a lot of guys, you know, are thinking about this. And it's actually like a really rewarding career. It's really more to it than you think.
Rewarding. Yeah.
So like,
I was gonna ask about that. Like, what do you think is like the benefits of being being a male in nursing? Like, if you had to tell somebody, you know, if you had to tell a male, like, oh, hey, you should think about joining the thing, like, what would you say to them, I guess?
I would say that it's very rewarding. I mean, like, and especially with a lot of things, because with doctors, I mean, I'm not bashing doctors. Doctors are really important. You know, they go through medical school and everything, and they have to learn all these, they have to know all the diseases and all the things that go on with the patient and stuff, and it's a lot. But, you know, nurses are just up there, you know, they don't have as much school, but everything is compacted into, you know, into shorter terms, like, and everything. Like, you still have to take anatomy and physiology, and we still have to take microbiology to make sure we know all the pathogens and everything, just as doctors have to know all the pathogens and stuff. Because it's like, in a regular hospital, you'll have an interdisciplinary team, which includes, you know, the nutritionist, the therapist, the
occupational therapist,
the occupational therapist, the nurse,
physical therapy,
the nurse, the doctor, and then the drug administrator and stuff. So that way, everybody has to, you know, go through all the same schooling and everything. So that way, when you have a patient with a certain disease, let's say a patient comes in with like cirrhosis of the liver. So it's like the liver is basically, you know, like it's going through like necrosis and everything and stuff like that. You know, the doctor initially has to know what cirrhosis is, blah blah blah,
symptoms,
and stuff,
everything,
and what could have caused it. The nurse also has to know that.
Exactly.
So that
the plan of treatment.
He or she as a nurse has to know the plan of treatment and everything and stuff like that. So that way, it'll be easier for the doctor, you know, for he or she to know what to do. And then, like, you know, the drug administrator has to know what cirrhosis is and whatever thing, so that way they can give the proper meds and everything. And then the nutritionist has to know
the proper diet.
Yep, the proper diet. And then the occupational therapist should probably help, you know, if it's impaired them from doing anything, like if they can't, like you know, do like normal functions like walk or anything or use the bathroom or something like that. Exactly. I mean, it probably doesn't have to do with that, but you know, it's the same thing.
And transitioning from there, this is the big topic we want to discuss of how, like, the nurse is very important in terms of, from the point of admission of that patient, the things that the nurse does from that point all the way to discharge, I think are so crucial. We talked about that, right?
It is.
When we were just hanging out.
It really is.
So crucial, because I was talking to him that, let's say, for example, a patient was SOB. They were shortness of breath, right? Just for like a short period of time, and you see that the head of the bed is down, right?
Yeah, you usually
exactly what you learn in like fundamentals of nursing, number one, like first step, 101, is to just raise the head of the bed if the patient is shortness of breath. You get what I'm trying to say? Not many people would probably think of that as the obvious thing, but it's like, it's the obvious thing. But I'm just saying that's one part of like her job that could help the patient.
That could, like, it could literally save the patient's life. Exactly. Like, because if, let's say the bed was to still lay down at, let's say after post-op surgery, the patient's was laying, you know, just lying straight on their back.
12 hours.
They're susceptible
pneumonia.
To like pneumnia or any nosocomial infection that could
creates
happen.
More problems, and that's what I'm trying to get at. That the nurse does so much, you know, to keep the patient stable. Is what I'm trying to get at. To keep the patient stable, it goes back to if the nurse doesn't even give the medication. Let's just say, obviously, she or he does give the medication. If they don't look for the symptoms, if they don't see the reactions, if they don't see what's going on with the patient after they give them the medication, the patient could just die.
It literally takes like a few seconds, and then boom,
just like
gone.
That, exactly.
And then
it's so easy to just say, "Oh, I got all the orders. I gave it to my patient. Everything's great." But you got to look at your patient.
And then the one thing that about this is the doctor has a lot of patients throughout the day. And he's not going to be able to be direct with
individualized care with
everybody. Now, nurses have a lot of patients as well, but they're more like indirect with the patients. Exactly. You know, they monitor everything a little more than the doctor has. Now, if anything goes wrong, initially the nurse has to contact the doctor and let them know, oh, they're not in stable condition, something, exactly. Blood pressure went up, etc., and stuff like that. And, it's just as important. Like, some guys will just think nurses, they just come out and they're just
hanging out.
They're just giving people baths. They're just hanging out, blah, blah, blah. They're not doing
very common misconception. And we don't blame them because they're just not exposed to it.
Yeah. Now, if a lot of guys I guarantee you, if you took some guys that didn't know that much about nursing and everything and just had that stereotype, you took them to, like, the ER where they saw the ER nurses and, how they had to do that admission process and everything and how many patients they have to deal with, coming in and stuff like that. They'll be like, wow, there's actually a lot of stuff that nurses have to do and that they don't, that they didn't realize and stuff.
Exactly.
And it's really like crazy how some guys just don't know that. And I'm not saying that I don't blame them. Like, exactly. They don't. If it's not their field, they're not gonna really, take interest in it.
Or it needs to be more spread out. They need to talk about it more.
So
And I was gonna bring up the fact that. Can you imagine that in just 2 years, let's say, for example, for me, like associates, I know obviously for bachelor it takes 4 years. 2 years of associates for a nurse, for a registered nurse. Can you imagine all that information, just 4 semesters? And you really know so much. Can you imagine? Mm-hmm. Because obviously you go to clinicals, right? You go to lab skills. They really do train you. I'm pretty sure whatever nursing college you go to, they're going to train you to make you the best nurse as possible. They don't want to throw you out into the field and you don't know how to do basic stuff like maybe maintain sterile field or contact precautions. Like these are like those are basic things. But if you know the basics, you can carry it all the way to the disease process and how you plan the care for your patient, for example.
And there's one major aspect I think that like plays a huge. It's like the holistic aspect of nursing. Like I like to help people. I like to seriously like whatever I can to do to help somebody because I figure I'm blessed. Why not help somebody else? That's not in their best health. And doctors do that too. Nurses do that too. But I feel like sometimes some nurses, like, don't get me wrong, there are doctors that spend as much time as nurses that try to spend as much time as nurses do and everything, but it's just so much harder because they have to deal with so many more patients, so many more things that they're on call for everything and stuff like that.
And it's not, obviously their job description, they don't have to.
Yeah, but there are doctors, like I know when we were in nursing school, we had one doctor, I don't know his name, I forgot his name, but he was in like the burn unit at San Diego University Hospital, and he was one of the doctors that took all the time, like when he used to shadow him and everything in the nursing program, the LPN program, and he used to take so much time just to go to like the patients that you make sure they were okay and everything. Like, he took nursing initiatives. Like if you saw him for the first time And you'd be like, why is he doing, like, he has another patient to work on, blah, blah, and stuff like that, you know. He still takes all that time. And, you know, there are doctors that are like that.
Definitely.
But, you know, in a profession that's, you know, that has so many things going on and everything, like disasters and stuff like that, you know, there's not going to be that many cases where you can just, you know, take your time with every single patient. I mean, nurses, at the same time, they have a lot of patients, but they can still give, you know, more. It's
more individualized. They're right
so
there.
It's like I can feel like I could be one-on-one with the patient. You know, they can talk to me about anything. You know, stuff like they can let me know what's going on, and I could be there for them. You know, 100% of the time. And that's what I think is like makes like a really huge difference, because you know sometimes you don't have to heal them. I mean, you could try your best, like physically to heal them and stuff like that, but like, you know, sometimes it's all about, you know, how they feel and stuff. So, you know, like you can give them, I know that there's some, I forgot, you know, like it's basically like a mental like placebo or something, where like, you know, if they feel better, you know, you make them feel comfortable and everything and stuff like that. Sometimes it even helps like the healing process as well, rather than just somebody thinking that, you know, they're about to die or anything. You could always be there and always, you know, have, you know, give them something else other than, you know, the initial medication and stuff like that. And that's what I really think that, you know, that makes a huge difference in nursing. That's why I personally chose to do nursing, to go into nursing like that. And then for you to know for them to all compact this into like less schooling and everything. Like you only go to nursing for school for 4 years, and after that you're basically an RN, and after that you can work. And then you can expand to get your master's, and then, you know, or you can go to get your doctorate. You know, I'm trying to get my doctorate and everything. So, and you know, there's ranks that you can get up to nursing. Some people don't think.
And there's another misconception that so many, like maybe guys or anybody doesn't really know that there's different, like, how you
rankings,
branches, or
branches, like
how you can branch out to nursing.
Nursing isn't just one field that you just stay in the hospital or you're just helping that. No, there's different, you know, units, and just how there's different doctors, there's different nurses as well.
There's ICU.
There's scrub nurses that help with surgeons and everything.
Coronary care unit. There's.
And then
try and name all of them.
I don't know, but there's a lot.
Emergency room.
But you know, there's different ranks, you know, and nursing doesn't end in end with your bachelor's. You get your master's, and then you get your doctorate. So, and like what I want to do, like you know, I want to be able to go. I want to see if I can get up to my doctorate, so that way I can, you know a lot about nursing, and I can deal with a range of patients, just like any other doctor would, but I would have the initiative of that a nurse would have. So that's why, you know, that's why I want to see if I can get my doctorate. It's gonna be a lot. It's gonna be a while, but you know, that's what I'm aiming for. It's one step at a time, which is, you know, and you know, that's one thing that some guys or some people don't know, that, you know, that there are different places in nursing that fit you. You don't have to just always be in that one place, always just, you know, thinking that you just, let me just take vital signs and blah, 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 and that's it and stuff. No, there's a whole bunch of other places that you can go. There's a whole bunch of other places you can expand and everything. And, you know, the rankings, it's just as important as being a doctor and stuff, like we've emphasized before and stuff and everything. So it's definitely a field that a guy should take into consideration if they're looking to go into the medical field for anything.
Definitely.
If you like math and science and everything, and you like, you know, you see
you
see the nursing field, and you're just thinking to yourself, you know, like, oh, maybe I shouldn't do nursing, you know, a lot of women get in there, blah, blah, blah. Don't think that it's at all, you know. Guys are just as important as women in nursing. They do just as much work and stuff like that. And then for people, I know, like, I get a lot more females, you know, tend to do nursing than males, but I feel like, you know, in the future, it's probably going to end up, you know, being, I want to say that, you know, in the future, you know, it's probably going to end up being even, you know.
Yeah, exactly.
So.
Oh, that's definitely a good idea. And I definitely want to say that we're not trying to, like I'm saying, as a registered nurse or whatever, we're not trying to say, like, oh, they're whining, like, oh, maybe there's not enough males, or, oh, we do, like, so much work and blah, blah, blah. It's not even going to be about that. It's just, we just want to let them know that there's another option besides, like, nursing is an option that you can take to, we just want to let them know that, you know, that like
the pros of it.
Yeah, we just we just want them to know that we are definitely just as important. Like, you know, we're not gonna say, oh, without us, you know, you're nothing. But without us, you know, most of that care that is being given towards you wouldn't even be there. You know,
just take it because there are a lot of they're not a lot, but there are male nurses that are out there that that see other guys that don't want to do it or that try to get into the field but just can't see why or how it would benefit them and stuff.
And every guy nurse that I followed when we were at Curtis High School kept on saying to me, Sam, keep going strong. That's pretty much they kept on saying to me. And it's funny how most of the guys I had followed were black, so they were just
African American.
Yeah, African American, but obviously black. They were like, keep going, Sam.
And it's not just males. It's not just us that we're just saying. Like a lot of females,
of course.
Like when we were in the hospital, they were like, it's good. We need a lot more male guys, and because they don't want it just to be a female dominated thing. They want to see more guys in it too. Because at the same time, people just want to see everything being evened out.
Yeah.
Like they just don't want to see guys always being doctors and everything.
Like how they say they don't want to see all the estrogen in the air. Sorry, girls.
But it's a profession out there. If you're thinking about doing the nursing field, if you're a guy out there, or even a girl, and you're just thinking, or somebody, or guy, or if you know anybody that's thinking about the nursing field,
encourage them. Yes,
encourage them. Like it's something that you will not regret. It's not easy. It's not easy. If you've seen like the other videos and stuff, it's not easy. You have to go to school and everything for it, but if you take it seriously, it's very rewarding for both a male and a female.
Exactly. And if any guys out there are thinking of doing nursing, first of all, number one, do it. Right? I don't even think about it. Do it. Just put in the application and do it. You know what I'm trying to say? If you're looking at going into the medical field, I probably guarantee, quote me on this, I probably guarantee if you're looking to maybe become like, a physical therapist, doctor, anything, and you start out with nursing, you might just continue with nursing and branch on out.
Because you'll see that there's a lot of stuff.
Exactly, there's a lot that
you can do.
As a registered nurse, you could branch out. You could branch out to finance. You can do anything, just from getting that bachelor's.
Because I'm not gonna lie. At first, I wanted to do nursing, and then apply to medical school, and then it's like I'm doing the same exact thing that doctors are doing. And then it's like all the stuff classes I'm taking, I'm gonna be taking that as well. And then I'm probably gonna end up working. I'm gonna be working earlier than me going to medical school again, then doing my residency, and then actually paying it off. Yeah. I'm gonna be able to work earlier and stuff. So that's another pro that you can put onto it. You start working earlier. And you can start.
Those are definitely the cons of like going for a doctor. I mean, even doctors do know that.
Yeah, that you're gonna pay loans.
At the same time, major con because
you're gonna pay loans. You're gonna pay regardless if you go to college.
No, not even loans. It's just so many years. You're dedicated to medical school and residency, and also the loans. But we're just saying that definitely if you're looking for something that doesn't require smaller schooling, but a good enough schooling 4 years.
Yeah.
And you're straight into the medical field, getting all kinds of experience. You're right there with
it's definitely a profession too that's rising where a lot of people are looking into it because it's more I think I want to say financially secure or something like that. Like a lot of people you can get it once you get out of college or whatever and you're RN and you pass your boards and stuff and you're a guy. A lot of places will be looking at you like, oh, he's because a lot of places want to hire more guys too as nurses.
Very true.
It's just something to think about.
That's so true. Because if you have 90% girls in your hospital, or let's just say 95%, hey, let's have 5% guys at least.
Yeah.
Let's add some guys into the group, right? Add a different sort of character to the group or whatever. That's definitely just better in terms of the progress, I guess. I don't know.
Yeah, but it's good. Listen, whatever you want to do. whatever you want to do. It doesn't even have to be in the middle. Just strive for it.
If you are watching this video, go ahead. No,
I'm just strive for it.
If any girls are watching this video, encourage all your guy friends to do nursing.
Telling you, man.
Yeah.
It won't.
I'm forcing you. Do it.
Remember, it's all up to you. But it's something in the back of your head.
Exactly.
So.
It's definitely, like you said, in the future, not many people are gonna be scared about it anymore. It's just gonna be a regular thing. Oh, you're a guy and you're a nurse. Okay, it's not gonna be nothing. Like now, it's just very awkward. Like, oh, you're a guy, really? Why can't you be a doctor? But
I mean, some. Not a lot of people do. I'm like some people do that. Not a lot of people do that. Some people are like, "Oh, you're a nurse. That's good."
Of course,
yeah. So
definitely. They'll definitely look at you different, especially the fact that when you're a guy, they'll look at you and be like, "Man, you're definitely making a difference." It's not very common. That's very good. All right.
Well, thanks guys for watching. Comment,
guys.
subscribe, share. Let your friends know about the video. Thank you so much for watching and taking the time. Hang with me and
should we tell them to hit the like button? I don't know if that matters.
I said like, comment, subscribe, do whatever you have to do to get this out.
Right? Yeah, exactly.
All right, guys.
See you
take it easy.
Another video. Adios.
Back into that shit again. And when we rhyme, brothers need to break their pens. It's the love movement never ends. The rap game will never be the same again. He came again.
Here I come again, you're feeling fine. The dog is like an overflowing rhyme.